Trevor Gordon. I'm with the Canadian Epilepsy Alliance. Today I have the opportunity to have a conversation with someone named Allison Kukla, who is with the Epilepsy Foundation. We're talking to Allison because we want to have a discussion about Sudep. Sudep Action Day is coming up on October 16th. Sudep Action Day is dedicated to raising awareness of epilepsy deaths worldwide. Allison is the Senior Manager for Programs and Partnerships at the Epilepsy Foundation, where she provides leadership for the Foundation's Sudep activities and bereavement support services. She's a public health professional with demonstrated success in coalition building, campaign management, and engagement strategy development in a variety of fields at the local, state, and federal level. Allison has a Master of Public Health and Prevention Science from Rollins School of Public Health, Emory University. Allison is also a person living with epilepsy, an epilepsy advocate, and is a former staff in President Barack Obama's White House and United States Environmental Protection Agency. So let's have a conversation with Allison with the Epilepsy. How are you?
Hey, I'm good. How are you doing?
Good. I love you have a nice plant behind you. You got a nice vibe happening over there.
Thank you. I'd have to thank my mother-in-law for that. She does house staging and helps stage my background, so we can give her a shout out.
Well, I hope your mom likes my background, so I need her blessing.
I'll definitely have to ask her. I'm sure she will.
Okay. Well, thank you for joining us. It's so exciting to talk to you from the Epilepsy Foundation. I appreciate your time.
Yeah, definitely. It's my pleasure. Thanks for having me.
And reading your bio, I have to ask you this nerdy rookie question. Did you have the opportunity to meet the president?
I did meet President Obama a few times, which, as you can imagine, overwhelming, awesome, once in a lifetime opportunity. So very, very cool.
Thank you for allowing me to ask you that rookie question. I had to ask. So in reading your bio, I learned about your connection to epilepsy, you being a person living with epilepsy. When were you diagnosed with epilepsy? And if you can share a little bit about your story, if that's okay.
Yeah, definitely. So I was diagnosed at 19, my freshman year of college. I see my cat is joining us now. And so I had a tonic-clonic seizure out of nowhere. I'd never had seizures before. And now it's almost 20 years later, and we're still, it's quite the journey to get to where I am now, trying different medications, pre-surgical evaluation, long EMU stays. But knock on wood, we're doing, it looks like 9 months seizure-free. Because my husband is very involved in all of the care. It's not just me. It takes a village when you have an epilepsy diagnosis. So I'm very grateful for my support system and all of that over these years.
So I see you are connected with Epilepsy Foundation. You work at Epilepsy Foundation. How did you get started with the Epilepsy Foundation?
I really was just volunteering with different epilepsy organizations and got connected to the foundation. And there was an job opportunity that opened up, and I was like, well, let me apply. I can't really pass it up. Like, this would be an amazing opportunity to continue my public health career and, help people in the disability community, epilepsy community, and I'm here just over 5 years now. So really amazing path that I'm really grateful for that.
So as you know, I work with the Canadian Epilepsy Alliance, and the Canadian Epilepsy Alliance is the umbrella of about 25 epilepsy organizations across Canada. You're with the Epilepsy Foundation. We do have those in the US that follow us on social media. If you could explain what the Epilepsy Foundation is to those that are in the United States watching us right now, what would you say? Explain the Epilepsy Foundation 101.
Exactly. No, that's the best way. Epilepsy Foundation 101. So we're a national organization too, and we have offices across the country to help us deliver our services. And we're really focused on, educational resources, advocacy. So going to legislators and working on bills, seizure safe schools and things, research. Research is so important, and connection. So making those community connections through support groups or different things like that. So I work at the national organization, and then like I said, we have offices across the country, various states, so people can get those in-person services as well.
As you've been talking, we are having an informal chat discussion about Sudep and Epilepsy Foundation, and comments are flooding in. And we have a comment from Preston that is really appreciative of all the hard work that you do with the Epilepsy Foundation, and he's appreciating the fact of Sudep getting spoken about. So thank you, Preston, for that thought, because it segues into my next question: is what is Sudep Action Day, and why do you think it's important to discuss Sudep?
Yeah, so Sudep Action Day started by one of the partners that we work with, Sudep Action in the UK, 2014. So it's been about 10 years now. And each year they come up with a theme. And this year's theme is Our Risks, Our Rights. And it's really a global effort to raise awareness about Sudep Action, or Sudep awareness, pardon me, and mortalities. Because it's so important to the other part of your question, to raise awareness about, because, I did not do that for my provider. I learned it from a bereaved mother. And, you can only the best care of your epilepsy if you know everything about your epilepsy. So that's why it's so important that we raise awareness about Sudep, educate, and have those tough conversations regarding epilepsy mortality, so people living with the condition can take their medications, different things to reduce their risks.
I mean, we always hear that Sudep is that elephant in the room that people are afraid to discuss. And even having conversations with Dr. Donner, who we both know, who is a strong advocate for Sudep, she will even say that neurologists are sometimes afraid to discuss Sudep. In your opinion, why do you think Sudep isn't spoken about enough?
Yeah, and I'm glad you shared Dr. Donner, definitely one of the advocates that I work with in the healthcare field. I think it's just not talked about. Like I said, it's a scary topic, but we talked about. We talk about scary stuff in healthcare all the time. And like I already said, if we don't know all of the risks that come with the diagnosis, we can't take the best care of ourselves. So I feel we've done better in having healthcare providers have those tough conversations with families and caregivers and individuals living with epilepsy. Organizations, there's so many community organizations that are putting resources out there to help providers have those conversations. So to help have those conversations too, if they're curious about Sudep or want to talk to their healthcare team about Sudep, there's different resources out there as well.
Which brings me to my next question. Perfect segue. the toolkit. So you are the leader, and you've put together this super mega power of team, the superstars and hard workers and hard advocates from all over, at least the U.S. and Canada. You can speak on this a little bit more. You put together a passionate people. How did this start? Talk to me about this, and what year it started and how you reached out to certain people. And I'm excited to hear how this all started, because you work your butt off here.
No, I appreciate it. I hear your excitement, and it's not just me. I can shout out my colleague Michelle and our Marcoms team, who really helps me. We'll get together, and all of our amazing partners. We're up to 11 here, sharing the resources that they have from their community organizations, like Danny Dibb Foundation, Your Epilepsy, all, and bring it the toolkit. Really, the vision is bringing those resources together so they're easily accessible in one place for everyone. And so by having them, available in one place, not everyone has to create their own toolkit or do their own thing. And so this is just an easy way to help everyone, with marketing and communication and, sharing it throughout the month. So, the idea really came from Sudep Action, since they have this day, the Wednesday of every October, Sudep Action Day. We're like, how can we just, bring community partners all really passionate about this topic? And so it's just kind of grown from there since I've been in this role for the past just over almost 4 years now. The toolkit has just grown and grown and grown with partners, which is wonderful. I've gotten some emails today that people have shared the toolkit with other partners, and more people. So the reach has just grown, which is great. And it's always fun to see afterward, the metrics and the, content, how far it reached and all of those things, that evaluation component of it.
How do you see this toolkit evolving? Like what's sort of your dream with this toolkit? Do you short term and long term goals with this? Are you already looking at a vision for next year after that? Like what's sort of where do we see this going?
Yeah, well, we always, partner with Sudep Action, since they are the brainchild of Action Day. We don't take any of the away from them. So always wait for they come up with a theme, work off the theme. So that's really kind of, how to create our vision, what is created, and then working with the partners, seeing the new resources that has come out and been created. So it's really amazing to see what materials created since last year's toolkit that this year. Like I know Annie did found us a webinar that they did, and there's some other resources that are new this year. So it's just, long-term vision is just having all of these toolkits easily available. We have it actually being translated into French here, which is cool, and we'll have that available shortly. So I think last year we were available in 3 languages. So having those opportunities where partners are, stepping forward and being like, hey, I do this once you have it and stuff. So having partners get more involved is kind of that long-term goal where, they don't have content to contribute, like, but I can translate it, or I can do this or that or whatnot, is wonderful to get, that engagement and more people involved in the project.
Cassidy Megan, the founder of Purple Day, is watching our interview right now, and she's saying it's such an important topic. The more we talk about it, the more we will eliminate the uncomfortability of the topic. And she's letting you know that you're amazing.
Oh, she's so sweet. I'm glad watching. She's definitely one of the champions in the community for sure.
So for those that are watching, whether it be in Canada, the US, all parts of the world, how can the public support this campaign, this toolkit all over the world? What would be that advice to the general public, or even specific epilepsy organizations across all over the world? How can the public help you?
Yeah, if you're interested in getting a copy of the toolkit, to share it on your social media channels or anything like that, ask. I can get it to you. Like I said, we're happy to share it. Also, our bereaved families are huge advocates in the public space. Sometimes the first time they hear about Sudep, it's after the loss, but it's so inspiring to see how they turn their grief into action, and they want to stay involved in the community, save lives by Sudep and raising awareness too. So just really continuing to talk about it, getting the elephant out of the room, making it a regular part of a doctor visit. So doesn't have to be like this scared conversation, but just like a typical conversation that is being had in the epilepsy community. But if anyone is interested in it, Trevor has my contact. We can, get that to you, and we're happy to have this information go far and wide to help raise awareness throughout the month.
And if there's an epilepsy organization watching us, whether we're watching live or in the re-record, and they want to get added to the toolkit, maybe not for this year, maybe, how do they, are you taking on more content for future years?
Yeah, definitely. Like I said, always looking for new information, new resources that are out there, because, you know, I am just one person at the foundation, so I don't know everything that's out there that other organizations do, which is why, you know, working with partners is amazing because it helps our reach. It learn about new content and resources that are out there. So I always love learning about new resources that can be, like I said, it's fun to look back at core toolkits that we've done and see, you know, we have all these resources in place. So we can continue to grow it, and we, you know, get new research, webinars, and new Instagram lives and things like that we can put in it in future years. So it's always fun to get that information.
Sudep Action Day is on October 16th. It's a day dedicated to raising awareness of epilepsy deaths worldwide. I'm giving you the last word, Allison. What would you like to say to everyone watching as we wrap up?
No, just thank you so much for having me, and for those that are in the healthcare field, having those conversations, those in the community that, you know, are helping awareness, and the healthcare providers that are helping raise awareness. And, you know, I could not acknowledge the brief that we serve daily, who also are, you know, helping raise awareness around SUDEP and all epilepsy mortalities. Without everyone working together, you know, we couldn't do this work, and we couldn't really move the needle to make this conversation more regular and, you know, just not a scary conversation. So really appreciate the partnerships that we built, and everyone, you know, working together on making this, you know, just another great SUDEP action that we're to raise that awareness.
And Allison, from the years that I've had the pleasure of getting to know you and talk to you, you're a very humble person. And I want to take a moment just to thank you for your leadership. Thank you for everything you're doing for epilepsy awareness. Thank you for rallying the troops, for lack of better words, of getting all these great partners together to sort of, with a common goal, to create awareness for SUDEP. So I want to thank you on behalf of those that watch, you know, that do everything for epilepsy awareness, and fellow epilepsy advocates. Thank you for everything that you're doing to get the conversation of SUDEP discussed. You are a rock star. You're amazing. And I appreciate your leadership. You're awesome.
Oh, well, that's very kind. I appreciate it. You couldn't do it by yourself. Working makes it even better and more fun to create new. So thank you so much.
And not to make this political, but I think Obama, the president, would be thinking you're awesome too for what you're doing. So hopefully he watches this recording. If you're watching, President, you know, it's awesome that one of your staff members is doing what she can for epilepsy awareness.
Well, I did do a seizure first aid training in the White House, so that was a lot of fun.
That is awesome. That is awesome. But I appreciate your time. Thank you so much. Thank you for joining us. I know you're a quite busy person. Thank you for doing this interview with us.
Yeah, my pleasure having me.
Thank you. Have a good day.
You too.
Bye.